This is the head. It articulates with the acetabellum of the pelvis to form the hip joint. This is the neck. It connects the head of the femur with the shaft. This is the greater trochanter, the most lateral palpable projection of the bone that originates from the anterior aspect. This is the lesser trochanter, smaller than the greater trochanter. It projects from the posteromedial side of the femur, just inferior to the neck shaft junction. The shaft of the femur descends in a slight medial direction. This brings the knees closer to the body's center of gravity, increasing stability. A cross-section of the shaft in the middle is circular but flattened posteriorly at the proximal and distal aspects. On the posterior surface of the femoral shaft, these are roughened ridges of bone called linea aspera, Latin for a rough line. The lateral border becomes the gluteal tuberosity, where the gluteus maximus attaches. The femur connects with the pelvic bone, forming the hip joint. It also articulates to the tibia and kneecap, forming the knee joint. Iliac and gluteus medius muscles insert to the femur.
The cervical vertebrae are from here to here on the spine, and they look like this, and they connect to other cervical vertebrae, thoracic vertebrae, and the skull. There are 7 of them, and this part is the lamina. This is the bifid spinous process. This open space is the vertebral foramen, and it's where the spinal cord goes through. And then this is the superior articulating surface, and these holes are the transverse foramens, and this down here is the body. And they support the skull and protect the spinal cord, as well as give the neck structure. The muscles attached to this vertebrae are the neck muscles and the sternocleidomastoid, and which is the muscle attached to the thoracic cage. Some unique features are it's small, and it is a bifid or Y-shaped spinous process, a U-shaped transverse process, and a transverse foramen, and they also have a triangular vertebral foramen. Thoracic vertebrae, and this is the spinous process. This is the lamina. This is the transverse process, and this boy here is the superior articular process, and this thing connecting is the pedicle, and the hole in the middle is the vertebral foramen, and this is the vertebral body. On my guy Trevor here, it's from here to here is where the thoracic vertebrae are, and its functions are to hold the rib cage and to protect the heart and lungs. There are 12 vertebrae of thoracic, and the thoracic vertebrae, their range is limited in the spine, and they are the only vertebrae with overlapping spinous processes, and the thoracic vertebrae connect to the cervical and lumbar vertebrae.
This is the lumbar and sacral vertebrae. The lumbar spine is the abdominal region of the torso, also known as the lower spine. It has about 5 vertebrae. The lumbar spine connects to the sacral vertebrae. The function of the lumbar vertebrae is to support the weight of the body, and the function of the sacral vertebrae is to connect to the pelvis and provide support. The lumbar spine has pieces that stick out all the way around the edges of it. This one right here is the transverse process. The big one in the middle is the spinous process. The hole down the middle of the spine is the vertebral foramen. The vertebral foramen contains the spinal cord, and all of its roots. The sacral vertebrae attaches to the hips. It has sacral foramen, which are areas which nerves and arteries come out of, in and out of. It has the superior articular surface, which is important for muscles attached to, and this big piece right here is the sacrum, which attaches to the pelvis.
The ossa coxae is a fusion of three bones, which are the ilium, the ischium, and the pubis. The ilium is made of the iliac crest, which is made of the thickened superior margin of the ilium, and is a site of muscle attachment. It is made of the anterior superior iliac spine, which is the blunt anterior ending of the iliac crest, which is a site of muscle attachment. Posterior superior iliac spine, which is a sharp posterior ending to the iliac crest, and also a site of muscle attachment. The anterior inferior iliac spine is a less prominent projection located directly inferior to the anterior superior iliac spine, and it is a site of muscle attachment. The posterior inferior iliac spine is located directly inferior to the posterior superior iliac spine, and is a site of muscle attachment. The iliac fossa is a concavity in the medial surface of the ilium, which is a site of muscle attachment. The ossa coxae is also made of the bone ischium. The ischium is made of the ischial tuberosity, which is roughened and thickened inferior surface of the ischial bone, and is a site of muscle and ligament attachment. The ischial spine is a projection located superior to the ischial tuberosity, which is a site of ligament attachment. The lesser sciatic notch is a small indentation inferior to the ischial spine and is a passageway for blood vessels. The pubis is a V-shaped bone which forms the most anterior portion of the ossa coxae. The obturator foramen is a large opening in the ossa coxae but is closed off by the fibrous membrane. The pubic crest is a thickened anterior border of the pelvis and is a site of muscle attachment. Pubis tubercle is a small projection at the lateral end of the pubic crest and is a site of ligament attachment. The ossa coxae attaches with the sacrum and the femur bones. The levator ani muscle originates with the pubis, and the rectus femoris muscle inserts the pelvis bone.
You have 8 carpals: the scaphoid, lunate, triquetrium, pisiform, trapezium, trapezoid, capitate, and the hamate. A way to remember them is by saying some lovers try positions they can't handle. Some stands for scaphoid, lover stands for lunate, tri stands for triquetrium, position stands for pisiform, that stands for trapezium, they stands for trapezoid, can't stands for capitate, and handle stands for hamate. These are the carpals, right here, these bones, these small bones. All the carpals articulate with the metacarpals, and the scaphoid and lunate articulate with the radius and ulna. The main role of the wrist is to facilitate effective positioning of the hand and powerful use of the extensors and flexors of the forearm, and the mobility of the individual carpal bones increase the freedom of movement at the wrist. The carpals are the reasons that your hand can go forwards, backwards, right, and left.
So this is the scapula. Over here is the superior angle, and it leads into the superior border. This notch is called the scapular notch, and then it leads over to the coracoid process. This part over here is the acromoid process. Down here is the lateral border, which goes to the inferior angle. This big spot over here is the subscapular fossa, and then over here is the medial border. A couple muscles that originate at the scapula are the biceps, triceps, and the deltoid muscle. The trapezius inserts into the spine of the scapula. The scapula connects to the humerus, and which is the upper arm, and then the clavicle, which is the collarbone.
The humerus is a long bone in the upper arm, and it is one of the longest bones in the body. This is the humerus. This is the head. This is the greater tubercle. This is the anatomical neck, and this is the surgical neck. This is the radial groove. Down here is the lateral epicondyle, the olecranon fossa, and it connects with the ulna, which is this bone, and the glenoid fossa of the scapula, which is your shoulder blade. Some major muscles are the deltoid, biceps, and triceps, and the pectoralis major originates on the humerus.
So I had the radius and ulna, and this is the radius right here. And the radius or radial bone is one of the two large bones of the forearm, the other being the ulna. It extends from the lateral side of the bone to the thumb side of the wrist and runs parallel to the ulna. The radius is shorter and smaller than the ulna. At the wrist, the radius forms a joint with the ulna bone. So some landmarks are the proximal radius, which is so there's the proximal, the shaft, and then this distal. So then the proximal's up here. The head of the neck, which would be this part up here, and then the actual neck part would be right here. And then the tuberosity is right here. And the portion of the anterior oblique line, which would be this right here. And then some landmarks for the distal radius include the styloid process, which is down here, the ulnar notch, which is in the middle here, and then the portion of the shaft, which is the middle again. And the function of the radius is the radius pivots around the ulna to produce movement at the proximal and distal radius ulnar joints. And one muscle that originates is the brachioradialis from the distal end to another end of a different bone. And the biceps muscle inserts on the bone. And then for the ulna, which is this bigger bone over here, the ulna is located on the opposite side of the forearm from the thumb. It joins with the humerus on its larger end to make the elbow joint, and joins with the carpal bones of the hand at its smaller end. Some landmarks are the olecranon, which would be the top part up here, the coronoid process, which would be right underneath it over here, the trochlear notch, which would be in the middle of it, the radial notch, which would be on the radius, right in between, right on here, the tuberosity, which would be also just a little higher up over here, and one muscle that originates is the flexor carpi ulnaris, and one muscle that inserts on the body is the anconeus. And together with the radius, the ulna enables the wrist joint to rotate.